Okay, now we're going to talk about injecting crow's feet. Crow's feet. The correct word is lateral canthal rhytids, but we could get away with saying crow's feet. All right, so I have a whole bunch of pictures that we're going to go through. The technique is really not difficult. I think there's a couple important things I want to stress when you're doing crow's feet. For one is your technique, how you hold the needle and how you point the needle. I see a lot of doctors and I see a lot of people that are inject like this, where they're looking at the crow's feet and they're injecting like this. And then just think what happens if they slip or something like that, they're going to go right into the eye. The way I always teach doing lateral crow's feet or lateral canthal rhytids is to always inject medial-laterally, away from the eye, okay, for safety reasons. All right, and what you typically do, okay, let me see if I could show you on this model over here. What you typically do, all right, this is the eye right over here. What I'll do is I'll have one of my fingers like this. Right now the other hand is holding this model, but what I'll do is I'll have one of my fingers over here, okay, protecting the eye like this and pulling back on the skin a little bit. Then I'm going to come around like this, and just like this I'm going to inject, and this is the technique, okay? And try to hold the syringe and the needle the traditional way. I see a lot of people holding the needle and the syringe like this, and then they go in like that, and then they have to reposition their hands. This is really the correct way to hold the syringe and the needle. Okay, so when you're doing this, you want to go like this, okay, and you want to just inject medial laterally like this, medial laterally like that. Okay, so that's kind of important. All right, now let's go over the dosage. What is the dosage for injecting lateral canthal rhytids? Of course, it depends on a lot of factors. It depends on the patient's age. It depends on how strong those muscles are in the area. So as you get good at this, you'll start to develop your own technique, and you'll start to understand this better. The next set of slides we're going to go over a bunch of examples so that you know. Now remember, we talked earlier about the first visit, second visit technique, okay? And again, just to reiterate what that is you're going to be going back, all right? The first set of patients that you're injecting, you may not see them again, right? You may work on them, you may see them 3 months later, so you're not going to really know if your technique is good or not. So what we do is we divide it into 2 office visits. The first office visit, you're under-injecting them. So where you might normally inject 20 to 25 units, as an example, on the first visit, just inject 8 to 12 units. Okay, so in the lateral canthal rhytids, first visit is the first time you're injecting somebody, under-inject them. Inject 8 to 12 units. Have them come back a week later. When they come back a week later, you're going to examine them. You'll look at them, and you'll understand what 8 to 12 units does on a person. All right. At that point, if you need to do a little touch-up, you go ahead and do a little touch-up. You may not need to, but if you need to do a touch-up, you can do that. All right. So here's a couple examples of what they're calling full fan pattern, and all that is you've got lateral canthal rhytids above and below, like you see here. This is lateral canthal rhytids, lower lid, upper lid, okay, and the different examples. So as we go through this, okay, the technique, as you see here, is you're injecting in a clockwise pattern. Okay, so you're going right around the lateral canthal rhytids, right around the eye like this. Okay.
Outside the orbit, right?
Outside the orbit. You always want to stay outside the orbital rim. That's correct. Okay, so just like you see in the picture, always stay outside the orbital rim, and you're injecting laterally. Okay, here's another couple examples. Something that's important, and I watch this during the hands-on, is that sometimes when people are injecting, they get a little too carried away, and they start to get really close to the eye, and they go underneath the eye. What's important there is if you wanted to inject underneath the eye, sometimes people have wrinkles over here, make sure you do the snap test. Make sure you do a very good physical exam. They're a younger patient, somebody that has good skin elasticity and skin tonicity, because if you inject underneath the eye, you could get this ectropion. Okay, so obviously you don't want that. Be careful if you decide to do that. Make sure you do a pretty good physical exam. Okay, so these are just some more examples of the different areas. So as an example, you could inject 4 units in each one of those spots. There's 3 spots that you see there. Okay, 4 units, 4 units, and 4 units. That would be a total of 12 units in this example. Okay, how about this example? Anybody have an idea how much you might want to inject? For your first visit, right? You've never injected this before. What might you think here as an example? You could do 2 units at each spot. That would be very little. It's very thin, the skin in that area. You would see a result for sure. You could even inject as low as 4 units for each one of those spots, which is a total of 8. And then they come back a week later, and you may do a touch-up. Now, when we start talking about the full dosage, you're going to see in your textbook that you could actually inject up to about 30 units in lateral canthal rhytids. So it sounds like a lot. And again, what we're doing is we're just talking about that for people who haven't been doing a lot of Botox, what to do on that first visit so that when the person comes back, you'll have a better understanding.
So what is the total? 30 units?
We have another presentation that we're going to do. It's about 30 units total that you can do, and it depends. The reason why I say depends if it's a male or if it's a female patient. Okay, but we're going to go over all the totals that you could do for forehead, for glabellar, and so forth. All right. So any questions on? And that's really it for lateral Canthal Rhytids. Any questions on how to inject that? Are you guys pretty familiar with the technique now? Make sure that when you inject, you're injecting medial laterally. Never inject towards the eye. Okay. Make sure you stay outside the orbital rim. Very important. And okay, Lorena, thanks.